Do you frequently feel like you're catching colds more than your friends? Or maybe you get lung infections every few months. If yes, your body might be struggling to fight germs the way it should. That could be a sign of something like Common Variable Immunodeficiency, or CVID for short. CVID is a condition where your immune system, the body's defense team, isn't working as strong as it should. Think of it like having an alarm system at home that's supposed to scare away burglars, germs, but it keeps failing. Because of this, people with CVID get sick a lot, especially with infections in the lungs, sinuses, or gut. But here's the good part. Once doctors know what's going on, they can help fix it. Want to know how and why this happens? Let's dive in. So what causes CVID? Well, scientists don't know the exact single cause yet, but they do know it's linked to problems in the immune systems, soldiers, especially antibodies. Antibodies are proteins made by B cells, a type of white blood cell, and they help your body recognize and destroy bacteria and viruses. In CVID, these B cells either don't develop right or don't turn into antibody-making factories like they should. Imagine having a factory that's supposed to make thousands of lock keys antibodies, but most machines are broken, so not enough keys are made. Without enough keys, the lock's germs can break in easily. Some people are born with this issue, often due to small changes in their genes. It's not usually passed directly from parent to child, but sometimes runs in families. So it's like a quiet glitch in your body's defense blueprint. How do you know if someone might have CVID? Let's play detective. Do you know someone who gets sinus infections almost every month? Or maybe a cousin who keeps needing antibiotics for bronchitis year after year? These could be clues. People with CVID often have frequent infections, like ear infections, pneumonia, or stomach bugs that just won't go away. Some also feel super tired all the time. Others might have swollen glands or digestion issues, like constant diarrhea or trouble absorbing nutrients. Here's a real-life hint. Imagine a student who misses school every winter because of pneumonia, while classmates only get a cold. Or an adult who gets a bad sinus infection every time the weather changes. These patterns are red flags. Sometimes the body even attacks itself, like attacking the thyroid or blood cells, which is another puzzle piece doctors look for. How do doctors find out if someone has CVID? It starts with asking, how often are you sick? Then they run blood tests. One key test checks your antibody levels, specifically IgG, IgA, and sometimes IgM. If these are very low and you keep getting infections, it points to CVID. But doctors don't stop there. They make sure it's not due to medicines, cancer, or other diseases. Think of it like ruling out a weak Wi-Fi signal caused by your router before blaming the internet company. Once diagnosed, treatment helps rebuild your immunity. The main treatment is called immunoglobulin Ig replacement therapy. Essentially, getting healthy antibodies from blood donors through an IV or under the skin. It's like refilling your body's defense supply every few weeks. Antibiotics help during infections, and some people need specialists for gut or lung issues. It's not a cure, but it lets most people live full, active lives. Can we prevent CVID? The truth is we can't prevent it from developing, because it's usually something you're born with or caused by hidden gene changes. But we can prevent the damage it causes. That's where preventive habits come in. Think of it like living with a car that has weak brakes. You can't change the brakes easily, but you can drive carefully. For CVID, that means staying away from sick people, washing hands often, and getting flu shots, but not live vaccines. Early diagnosis is prevention too. The earlier we catch it, the less damage infections due to lungs or organs. So while we can't stop CVID before it starts, we can stop it from stealing your health over time. Scientists are working hard to crack this puzzle. One cool advance is learning that CVID isn't just one disease. It's more like 20 different versions hiding under one name. Some researchers are using genetic tests to find which gene changes cause which type. Why does this matter? Because treatment could become personalized, like choosing the right key for a specific lock. Another big step is exploring new therapies beyond egg replacement. For example, some trials are testing if certain immune-modifying drugs can wake up sleeping B cells. Also, apps and digital trackers are helping patients log infections and symptoms, giving doctors better data. Imagine wearing a smartwatch that alerts your doctor when your pattern of coughing looks risky. That future is closer than you think. Science is turning CVID from a mystery into a manageable condition, one discovery at a time.